Jumnipsua. Good day. I'm Ambassador Patrick Murphy at the U.S. Embassy. We're delighted to have you all with us. This month of May is Public Health Month for the U.S. Embassy. And why? The reason is we're celebrating the 70th anniversary of diplomatic relations between Cambodia and the United States this year. It's been 70 years of partnership and friendship. And throughout the year, each month, we're highlighting a different area of cooperation and collaboration. It's been a terrific year so far. And all during the month of May, we're focusing on our collaboration and partnerships with health. How timely. The world is experiencing a global pandemic. And the response here in Cambodia has been very impressive, very complex. We like to think part of the response has been built on strong foundations of health partnership between the United States and Cambodia that go back several decades, working on infectious diseases and healthcare systems and all sorts of responses. Today, I'm really delighted to have two guests with us. Dr. Sophanith Ung, who is from the Svay Rieng Provincial Health Department and is a specialist who works on malaria and dengue. Delighted to have you with us. Thank you very much. And our very own Dr. Michael Kinzer from the Centers for Disease Control, CDC, where he is the Global Health Security ProgramDirector. And one of the things that we're going to be talking about today is not just the response to the global pandemic, but something that is called the Field Epidemiology Training Program, FETP, and we're going to learn about that in a few moments. But first, Dr. Kinzer, maybe we could start with you. Tell us a little bit about yourself and your background. What brings you to Cambodia? And why are we so impressed at the American Embassy with your good work? Because I know we are. You've been doing terrific work.
Well, the team has been doing terrific work. We have a strong team here thanks to the relationships that you've mentioned previously. I'm a medical epidemiologist with the CDC, which means that I am a medical doctor who focuses on public health and how diseases move through populations. This program is actually near and dear to my heart because I got started with this in the CDC with a similar program called the Epidemic Intelligence Service, which is our national program training disease detectives. It's 2 years, you're placed in a state public health department or at CDC headquarters, and you're responsible for routine surveillance of a variety of diseases, but also outbreak investigations when they happen in your area.
So you just mentioned a very interesting term, disease detective. That sounds pretty exciting. And I know from some of your background, you have been chasing diseases all around the world, and some of the very well-known difficult diseases like Ebola, and of course malaria and dengue here in Cambodia and elsewhere. But tell us, what is a disease detective?
Well, disease detective sounds exciting, and sometimes it is, but it's also routine. A disease detective, which is not an official term, but it works, I think, best for getting people the idea of what their job is you are responsible for routine surveillance of diseases of interest in your area. So in Cambodia, it would be dengue or malaria or HIV. And then you're also responsible for recognizing when there's a problem and doing something about it. Now that something can be getting in a car and going out to the field and interviewing people and finding out what happened. But it could also be looking at data and finding trends and spikes that maybe other people didn't notice and looking for reasons why a certain disease could increase in numbers at a given time.
So part of the training program that we're talking about, Field Epidemiology Training Program, is producing disease detectives. Could you tell us a little bit more about this program, FETP, how it got started here in Cambodia, and what does it actually do?
Well, the FETP program is my favorite program at CDC. I think it's one of the most important things that we do worldwide. It started over 40 years ago. It's an overseas program, so they're only training people in other countries. And it focuses on training public health staff at the front lines to run surveillance systems, to keep an eye on diseases in their country, but also to react when those diseases raise their heads, investigate, respond, and control them. We've been training people, like I said, for over 40 years. We're in over 40 countries. The program here in Cambodia has been operating since 2011 and has to date trained almost 150 people.
And one of those products of your training program, I think, is Mr. Panit. Am I correct on that?
Correct.
And I'm sorry I called you doctor earlier. I know there's a distinction, and you do a lot of work as a technical officer. But tell us how you came into the field of epidemiology, because it is now on display around the world. This global pandemic, unprecedented for our generations, we're all experiencing, learning new technologies. And we're knowing a little bit more about your work, but how did you come to it? How did you choose this field of study?
Okay, thank you for the question, Mr. President. Actually, I am a nurse working for Svay Rieng Provincial Health Department for 9 years. My work mostly, I am in charge of dengue and malaria control program, and also I am a rapid response team. In brief, my work is mostly focused on disease surveillance system and response. In 2015, I graduated from Cambodia Applied Epidemiology Training Program, which is supported by World Health Organization and U.S. CDC. And from 2017 to 2019, I joined an advanced course of Field Epidemiology Training Program in Thailand.
Mm. Well, let's go back even further. When you were a young boy, thinking about what you wanted to do in the future, you could have done many different things. You could have been a teacher, a farmer, working with computers maybe. How did you choose working with disease? What attracted you to epidemiology?
It kind of in like an accidental thing. I actually want to be a designer and a graphic designer, but finally I end up with a nurse because it's one of my favorite field for my mom. But I actually didn't feel like public health or health sector. But since in 2014, I joined a training course, and I joined a course that talking about epidemiology, a short course, and I feel that through the course and through the people's story, I come up with excitement to interesting about disease, to learn about statistics, and it really like how to say, it really exciting story that you can find something new or you can solve people problem where your skill. That kind of exciting.
That's terrific. And well, congratulations on choosing this field, because to be a nurse is these days considered quite courageous. You're coming into contact with diseases and you're helping people in need. Now, for the Field Epidemiology Training Program, FETP, to become a disease detective, how did you hear about the program and how did you pursue it?
This program was announced by Cambodian CDC throughout the country, and I think that I am capable of it, and I want to join with a team to fight for public health issues to bring back the welfare for Cambodian people.
Thank you so much. And Dr. Kinzer, so CDC these days is quite well known. To many, it's been known for a long time, but during the global pandemic, very well known, right at the forefront of combating the global pandemic. Could you tell us a little bit more about CDC's work here, and specifically with the Field Epidemiology Training Program? And what other agencies are involved?
Well, CDC has been supporting field epidemiology training in Cambodia since 2011. Like I said, it's one of our premier programs. It's one of the ones that is at really the nexus between a lot of different public health activities. They rely on laboratory data to find out what a disease is and where it is. They rely on surveillance systems to detect those diseases. They rely on the Ministry of Health administrative structure to respond. But at the center of that is the FETP graduate, who is really the frontline worker for all those programs. The other agencies that have been supporting us, because we don't do anything alone, WHO has been a critical partner, both technical and financial. They've got an office here with epidemiology and laboratory experts, and they've been hand in hand with us since the beginning here in FETP. KOICA, the Korean Development Agency, has funded a lot of our work for the last few years. We also have collaborations. We've had people from RCAF, the Ministry of Defense, trained in our program. We've also built relationships with the Ministry of Agriculture, Forestry, and Fisheries, trying to train some staff or work with staff in the animal health sector, this One Health approach, where we recognize that diseases come from animal populations, and if we can catch them there, we can save more lives in the human population.
And what do you hope that graduates of the training program here in Cambodia do? What do you hope to see them build in terms of a network, in terms of capabilities for Cambodia?
Well, ideally, we'd have a multi-level program, a basic program for frontline workers in the districts, an intermediate program for workers at the provincial level, and then an advanced program like the one that Mr. Sophanith graduated from for national level staff. And as you get higher, you get more in-depth training in the analysis of data, in policy making, and program management. It's a much more high-functioning position. But that's sort of our long-term goal. But our short-term goal is to make sure that we have graduates from the frontline program in every district in the country so that we'll be able to respond quickly and appropriately when disease rears its head.
And it has in Cambodia, right, Mr. Sophanith? There have been outbreaks of diseases here in Cambodia. Could you tell us about some of them and how you've played a role in responding to those outbreaks?
Yeah, last year we had a spike of dengue outbreak in Cambodia,
Dengue fever.
I've led the disease investigation in my province. With the community work, with the hospital staff, and with the team, with our team, rapid response team. From last year in 2018, I have joined an outbreak investigation of pufferfish poisoning. Pufferfish is a kind of fish that have many species, and some types are very poisonous, and if people eat it, it kills people quickly. We work with the affected community to find a solution to help them stop eating the pufferfish. Yeah.
Pufferfish.
Yeah.
Where does pufferfish come from?
It lives in like specific places where it can be breeding in some specific month. We can find it throughout the Cambodia.
Really?
Yeah.
In freshwater or
Fresh
saltwater?
water. Both freshwater and saltwater.
Saltwater as well.
But what I investigated is freshwater.
So there are pufferfish in Cambodia. People were eating them, which you're saying is not a good idea.
It's not a good idea at all.
So take pufferfish off your menu. That might be a good idea. So there was an outbreak and people were being poisoned by eating pufferfish.
Yeah, and people die. And we see people still enjoy the food because it's delicious, but it's very dangerous. So I attend the investigation and guide people not to consume pufferfish anymore.
And have you seen some progress? Are public awareness growing? And
we didn't see any more case from that community since the investigation until now.
Right. Dr. Kinzer, we know Cambodia is not unique in facing disease challenges, but could you help us understand what are some of the other infectious diseases that Cambodia has to contend with and nurses and public health officials have to be prepared to respond to?
Well, two examples. One is sort of a more local level problem, and one is a bigger problem. The first one is just in general what we call food poisoning, so foodborne illness. And that includes pufferfish poisoning, but it can be a variety of bacteria and viruses that find their way into the food chain, either through the way food is grown or harvested or butchered or prepared. And I think that's far and away the most common outbreak that we investigate. It's sort of a classic epidemiology study where you show up, you interview, you find out who ate what, and then you can find a clear association with a particular food and help people understand how to avoid it in the future.
So that's what you would call disease, not necessarily infectious disease. Am I correct as a layperson asking?
Most of what we investigate is infectious. So it would come from maybe someone who's preparing the food who has the infection.
I see.
Or from the food substance which has been infected previously and then gets prepared and consumed. The pufferfish, it's correct, sir, that's not infectious. And in fact, when we look at sort of how cases show up, when there's one particular thing that gets eaten one time, the case profile looks different than if you have somebody who is infecting people over time. And the second example of disease that we're concerned about in Cambodia and in the region is influenza. Not just seasonal influenza, but new kinds of influenza. And FETP graduates have been critical in staffing surveillance systems that we have put in place with other partners in Cambodia to detect new kinds of influenza before they can infect others. And we've been able to repurpose those systems now that we have COVID, which has a similar mode of transmission and similar group of susceptible people, to try to do a better job of detecting COVID.
Now you mentioned COVID-19, COVID Daprambun. I'm certainly learning that Khmer. The global pandemic has affected every country in the world. I wonder about the impact here in Cambodia. And Mr. Panit, could you talk about this in Svay Rieng, in your province, what you've seen with COVID-19 and how provincial public health authorities have responded?
Yeah, in Svay Rieng province, we have only 2 FETP graduate, and so far we work closely with the community to bring about their awareness of COVID-19. We actively working close with the community to find the suspected case, as well as to collect sample from the community as well as from the hospital. And also, we did a sample collection. We do a health education campaign, and also we also provide personal protective equipment, PPE, like wearing mask properly, clean hand, or wearing a gown or something like that. So far, we have 21 suspected cases that have been tested, and also we have conducted 2-time health screening. Those 2 times we have screened for 310 people that just arrived and working at a risk area. And just this week, with the supervision from the Cambodian CDC, we have conducted a hotspot surveillance of COVID-19, and we collected 88 samples from the high-risk area for testing for COVID-19 virus.
And Dr. Kinzer, you've been partnering with Cambodia at the national level in addressing COVID-19. And as a diplomat, I'm always learning new vocabulary, but this year we've learned, all of us around the world, a whole range of new terminology, like contact tracing, communal transmission, flatten the curve, social distancing. It's pretty amazing. 4 months ago, I had never heard any of these terms, really. Can you tell us a little bit about what these terms mean and what's been happening at the national level in terms of addressing the pandemic?
Sure. Contact tracing is pretty simple. It's trying to find everybody that a confirmed case could have exposed, could have infected, and following them to make sure that they get tested if necessary, but certainly followed while they could be incubating the disease and prevented from passing it on to the next generation. Flattening the curve, basically if you picture a line of cases in a country going up and then going down, that's the curve, and what you want is it to go up much more slowly and go down more quickly, as opposed to a big peak like you've seen in some countries around the world. We've been really fortunate in Cambodia in that almost as soon as we had the second case in Siem Reap, the Ministry of Health worked very closely with partners to set up contact tracing. And without a vaccine, without a curative therapy, that's really the only tool we have to flatten that curve and stop transmission. We were able to assemble a multi-partner group very quickly, including FETP graduates, train them, develop a contact tracing protocol, train the contact tracers on doing that, and then work out a system where every day new cases were assigned to lead contact tracers who then interviewed those cases, use the interview to develop a list of people they could have been around, and then follow those people for the next 14 days to catch them if they ever developed symptoms or tested positive. And by doing that, just doing that every single day, we were able to identify 27 cases that wouldn't have been found otherwise and probably would have infected others. And I think that's one of the main reasons that we were able to prevent the development of widespread community transmission in Cambodia.
So that's really interesting. This is the true work of disease detectives, isn't it? Publicly, most of us know in Cambodia there have been about 123 cases or so, but behind the scenes, you have just pointed to the fact that a lot of work is undertaken to find some of those cases. So how does that help? Can you tell us the logistics of actually tracing and finding contacts in a place like Cambodia? How does that work?
Well, it's not always easy, and Mr. Pranit has been on the front lines of that as well. For instance, we had one cluster of cases in travelers returning from Malaysia. We found out about an outbreak in Malaysia. We found out that there had been people who had gone to this meeting, and then when they got tested, we started to get positive results. By the time we got involved, we had over 20 positive cases in 10 provinces. So it was a very complicated cluster. And the Cambodian CDC Ministry of Health moved quickly to develop a task force just for that cluster. And Mr. Pranit was a member of that task force, where they divided up the cases by province, assigned provinces to individual contact tracing leads, and then those people took over the job of calling the cases, finding out who their contacts were, and then beginning the process of tracing them. We also have a nice system here in Cambodia which was able to unburden some of our contact tracers, and that's a 115 hotline that people can call. And that same software that runs the 115 hotline could be repurposed to auto-call contacts, especially the low-risk contacts. Higher risk, medium risk, we wanted to work more closely with. But we followed over 2,000 contacts over the past 3-4 months. And even the good team we have and the extra hands we got, it's a lot of work to do that every single day. And that auto-calling system unburdened our contact tracers and allowed them to really devote most of their time to finding the contacts that we hadn't found yet, instead of just constantly calling people every day.
It's an incredible amount of work. And Mr. Pranit, since you were part of that process, could you tell us what was that like, contacting people, and how do they respond when they're contacted with questions about contacts and disease and infections?
Yeah, we work closely with the contact. When we identify the confirmed cases, we will interview the person, the patient, to set up a list of contacts that have been contacted to us in the past 14 days. And then after identify the contact, we will start immediately to call those contacts via our phone normally, and we will ask them about their contact history, and we will categorize them whether they are in the medium, low, or high. Yeah, and then we will start working with them every day for 14 days until if any of them have symptoms. According to guideline, we will start quarantine them immediately and test them.
But they weren't always happy to hear from us.
Yeah.
Not always.
Yeah.
So these are some of the difficulties, right, in the work that you do. And maybe, Dr. Kinzer, tell us a little bit more about some of the challenges and also the future of this training program to continue to produce disease detectives in Cambodia.
Well, one of the biggest challenges is the fact that we're dealing with coronavirus right now. It changed our schedule for this year. We were planning to train a few more cohorts. Right now we're looking at towards the end of the year to be able to actually train our cohort, and then next year hopefully go back to normal and be able to build up the body of graduates. You know, with over 100 districts and only able to train about 20 people at a time, we really need to have multiple cohorts in a year. And then as we get those people trained up and positioned in the districts, they'll start to show how valuable they are to the Ministry of Health, and that'll help us in our discussions with them about taking over the program. Because with any country's FETP program, the end goal is for the country to take it over and run it itself. And once you've got graduates all over the country, it's not multiple cohorts every year. You can just run maintenance, one cohort a year just to maintain the level of training. But that's not easy. Countries need to develop budgets. They need to be shown that it's worth it, because Cambodia has a lot of things that it needs to devote its resources towards, and we need to convince them that this is worth funding. And that's what we'll spend most of our energy on over the next few years, training graduates and showing how useful they can be.
Well, the work that you both do is so fascinating and so interesting. In the few minutes that remain, I wonder if we could learn a little bit more about each of you and some of your experiences. Mr. Pranit, I believe you had an opportunity to travel to the United States last year as an international visitor leadership program participant. And this was a health-related trip. Could you tell us a little bit about what you did and what you learned in the United States?
In the United States, I went for an IVLP, which stands for International Visitor Leadership Program. We went to several places. We went to learn about the health system of the United States. We went to visit several places that we went there, and I'm surprised with how big the United States is.
It's a big place, huh?
Very
What
big.
kind of places did you get to visit?
I visited several places, and I went to Washington D.C., North Carolina, Texas, and San Francisco for the last journey.
You crossed the entire country. That's
Yeah. One of the main things that I'm interested about the visit, let me pick one place from the visit, is NOAA.
the National Oceanographic Administration.
Aerospace Administration.
Aerospace Administration. Okay,
Yeah.
great.
And it's very huge, and it's not only working for to have the people in the United States, but they follow up the event across the globe, especially about the weather, and they inform people in real time about the risk that will affect the people across the globe. So it kind of fascinating places, fabulous experiencing. We're visiting how technology have developed and bring out method and prevention method to help people not only in the United States but help all people around the world as well.
Excellent. I'm glad you had a great experience. I hope you have another opportunity to get to the United States. And quickly, Dr. Kinzer, you're a medical doctor, but you're also a member of the uniformed U.S. Public Health Service. Is that correct?
Correct, sir.
With a rank and a uniform. Tell us a little bit about what that's like.
The Public Health Service is the only uniformed public health service in the world. Our boss is the Surgeon General. There are quite a few of us. There are about 6,000 officers, mostly in the United States, but also in other countries like myself. We are staffing disease control programs in the States. We provide health care in places like Native American reservations, some prisons and jails. We are the leaders of the public health system in the United States.
Well, excellent. Thank you both, gentlemen. I'm Ambassador Patrick Murphy. We've been talking today about public health and specifically Field Epidemiology Training Program that the U.S. Centers for Disease Control works on here in Cambodia. This is Public Health Month, the month of May, and it's part of our 70th anniversary this entire year, celebrating the establishment of diplomatic relations between Cambodia and the United States. And I've been with Dr. Michael Kinzer from the U.S. CDC and Mr. Panit Ung, who is a nurse and a technical officer in Svay Rieng Province with the Provincial Health Department there. Thank you both for your expertise and for your contributions to keeping us all safe and healthy during this global pandemic.
Thank you for your support.
Sir.